As you all know, May is Mental Health Awareness Month, and in recognition of the occasion, we're honored to be here today to tell you all about it, an impactful new expansion that is going to get housing, resources, and supportive services to people who are frequently suffering from a mental health crisis.
In July of 2015, we announced the Community Connections program. It's a reentry program with the city of Albuquerque, and to date 72 people have been housed. The goal was and is to provide permanent supportive housing and case management for people who are exiting MDC and have a behavioral health need. We've seen great success with the reentry program. One client, who we'll call Angie, said, "I have so much support here to better my life, and the people really care." We're very proud of Angie and all the folks who are going through this process. We feel it's important to initiate this second phase, so we're leading this effort using the same model to help a different group of folks and dedicating $1.2 million to the expansion. The next year's goal is to house 55 more people.
For the last 30 years, we've provided primary medical, dental, behavioral health, and social services to people, exclusively to people who are experiencing homelessness in our community. That's a long time. We've learned a lot. We provide services both here at First and Mountain at this campus, which we invite everyone to come visit, as well as out in the field. We're very good at taking services out to where people are who can't come here. We understand the experience of homelessness, and we know over those 30 years that we can piece together all the important pieces to end someone's homelessness, but as an organization, we can't do it alone.
Bernalillo County, together with our partners at the City of Albuquerque, our subcommittee members, ABQ Interfaith, NAMI, and UNM have been diligently working to formulate a strong plan for how to best implement the Behavioral Health Initiative dollars. A vital piece of that plan is housing. We know that permanent housing can create a very stabilizing effect. For me personally, I call my home a sanctuary. Now that's where I go. I kick off my shoes, I relax, I decompress. Everyone needs that.
Through the experience of crisis in my life, actually I was a legal provided citizen, doing quite a few things, but then there was a distraction in my life and the substance abuse. And it could affect anyone and everyone if you allow it to. And it took me to a location that I didn't exactly know who I was or what I was doing. And through the incarceration, it turned my life around. And this program came into the facilities, and once they came into the facilities, I had the opportunity to step forward and go before them and ask for help. And through the help that I asked for, it was a very good program. And the program actually brought me through from the facility of incarceration to temporary housing. For an example, I would say in a hotel. I stayed in the hotel, and through the hotel, there was a time of process of being able to figure out who I was. And then after that, they went through a transitional program. And through that transitional program, it continued to give me hope and encouragement and inspiration. And after that, I went through that program, I was approached through one of the staffs to say, now it's time for you to call your resident your own. So they gave me the opportunity to look and search for a resident for myself, in which I found. And I was very pleased with it. And through that, the program have actually offered so many resources and opportunities for any individual that has a desire to change their life. And I'm so grateful and thankful that I have the privilege to be able to voice it and say that the program does work. And if there's anyone that willing to change their life of any crisis, this program would definitely help them. And through now, I'm in the process of the transitional to be able to step out and be a productive citizen. And I just thank this program for everyone that actually participated in it and that gave me support and to see where I am now. Thank you very much.
At Albuquerque Healthcare for the Homeless, we often say that we can end homelessness. We can address behavioral health needs, we know how, and we can interrupt the cycles. We as a community create the situations, the policies, and the allocation of resources that create homelessness and poverty. And allow some of these problems to be perpetuated. So we as a community can come together and make change. That requires private providers, the service industry can't do it alone, community members, neighborhood representatives, and our local government. The county has really stepped up to that. I think that the very real experiences of the 72 people who've been housed and remain housed through Community Connections is an example of that.
Based on previous studies, we expect the health and quality of life of our clients to vastly improve, that there will be a reduction in emergency services and hospitalizations, as well as a decreasing involvement in the criminal justice system. If you're a landlord, we're asking that you work with us to help us get these folks into housing for the betterment of each individual we house and for the community as a whole. Thank you all very much.